Crescent City Retirement Group, LLC, is not affiliated with or endorsed by the Centers for Disease Control and or any other government agency. This is Retirement Keys with Anthony Congemi from Crescent City Retirement Group. When a part of your financial strategy is out of tune, your long-term goals, your retirement savings, and your legacy can all suffer. With many years of experience in the financial industry, Anthony provides his clients and prospects with the information they need regarding Social Security, retirement income planning, wealth management, and much more. Listen in as we address your financial concerns and provide helpful solutions to put you on the path to achieving your retirement goals. And now, here is Retirement Keys with your host, Anthony Congemi.
Hello and welcome back to another show, Retirement Keys. My name's Anthony Congemi with Crescent City Retirement Group, and we have our amazing co-host with us today, as every Sunday morning. And we're so thankful to have Tony. He's really just brings, a wealth of knowledge. He talks to advisors, retirement planning advisors all over the country, and is able to really glean so much from so many different advisory firms, and just his exposure that he has. So we just couldn't be more thankful to have Tony co-host the show. So Tony, thank you for being here again, sir. How are you?
I'm doing great. Thanks for having me on your show once again, Anthony. And I'm really excited about this one. I know we're going to go over something that's been affecting a lot of people out there, and that's long-term care. But yeah, me and my family, we've been doing really good, all things considered. And, I've been working hard. How about you? What's going on over there?
Yeah, same here, Tony. All the kids, they have another week, I think, and then they're out of school. And my wife, Brandy, has been doing a lot with them as far as, with this new normal that we find ourselves in, doing, online, pretty much everything as it relates to classroom activities and their curriculum. One's in from college, and so they're all, busy wrapping up the year. Surprisingly, they all did really well through all of this, and we're just, looking forward to our economy is slowly opening back up. So things are opening up, and you will be able to get out more, and of course small businesses, which are just so important for these small businesses to get back up and running. And so we're really just thankful and grateful for that things are getting back to normal, in a slow, steady, and smart way, but nevertheless getting back to some level of normalcy.
Right. So today I know you wanted to talk about long-term care. And I know this is a huge, huge issue, and there's a lot of confusion about what Medicare covers and what Medicaid is and what that covers. Let's talk about, just briefly here, some Medicare and Medicaid. What is that?
Sure, Tony. So Medicare is a federal health insurance program for people age 65 and over. Those who are disabled or on dialysis patients, or on can be on Medicare as well, even if they're under 65. Medicaid is also a health program, but it's for lower income people of any age. And it's run a little differently because it's run by the states. Clearing up confusion is exactly what the nonpartisan Kaiser Family Foundation set out to do with its article, The 10 Things to Know About Medicaid, Setting the Facts Straight. So a great article. It was published in March of 2018. We choose a few of the 10 things that we felt would best explain what you need to know about Medicaid. The first is just a high-level overview of the program. Medicaid is the nation's public health program for people with low income.
Sure.
So it's a state-run program, and it's for lower-income families or individuals. And thank goodness it's there, Tony, because it's helpful. It is helpful.
Well, and here's how it ties in. I'm going to go off of Medicaid here just for a minute, Anthony, and just talk to you about this. because a lot of people think Medicare, which is what most people are on, no matter how much money they have, we all utilize Medicare once we hit 65 typically, or we're retired, then we go on Medicare. But what people, I think a lot of people don't realize, and you've told me this before when people first come to you, Medicare doesn't cover long-term care, does it?
No, Tony, it does not cover long-term care, and I think people, and again, I'm a big fan of Medicare, and I like the original Medicare primarily. For me,
sure,
it's my opinion, traditional A and B,
yep,
but it's Medicare. Think of medical care, hospitals, and doctors. So much like when you're employed and you had your health insurance, maybe from your employer, you may have also had a disability insurance, a long and short-term disability. Well, you know that your medical insurance or your health insurance was a different policy than your disability policy, right? I mean, it just covered two different things. A lot like this Medicare and long-term care. Medicare is your medical or your health insurance, hospitals and doctors, but long-term care is something different. And I think that's sometimes that's not clear, and people think that Medicare is going to pay for their long-term care, and that's just not what it was designed to do.
Right. And so Medicaid, back to Medicaid now. That was Medicare. Now Medicaid will cover long-term care based on different situations in some cases, but not until you're basically completely broke, right? And that's up to the state. It depends on what state you live in and what their rules are. I mean, Louisiana, there's Medicare or Medicaid that will kick in if you can't afford long-term care. But you'd rather not get to that point ever, or have your loved ones get to that point, because they're not going to be able to be in a top facility and things like that. So I know there are alternatives, though, out there, and we do want to talk about this a little more. Anthony, I know you work with your clients to figure out how are they going to cover health care and retirement. So, that's where Medicare comes in. But Medicaid is quite popular for people who just can't afford that long-term care, isn't it?
Well, Tony, a large number of Americans are covered by the Medicaid program, many who have expensive and complicated care needs. Most enrollees in Medicaid have few or no other affordable health insurance options. Americans with long-term care needs also often covered by Medicaid. The program is governed by Title 19 of the Social Security Act and a number of federal regulations, but the states have some say into it as well. And as you were saying earlier, Medicaid is, operates, different states have different rules and different qualification criteria. And so obviously understanding in your state, Louisiana, if you're here, or Mississippi or Texas or wherever you're listening, obviously the states have different rules. Right. And so it's important to know what those rules are. But Medicaid is an alternative for long-term care. But as you had pointed out, there's typically some type of spend down process or something along those lines where you have to qualify, and typically you have to have spent, most of your dollars down.
Yeah, and that's tough. But it also, and this, I'm going to jump to the part where I say now that sounds confusing, right? I mean, I don't want people to get confused, and that's why we have you here, right?
Yeah, it can be, Tony. And as you could imagine, this leads to the wide variety of differences in Medicaid from one state to the next. There are, however, two guarantees that from the basis of Medicaid. One, every American is eligible for Medicaid. It's guaranteed coverage. And two, the states that provide that coverage will receive matching dollars from the federal government for qualified services. So, I mean, it's a real blessing there, Tony, to have, because it's kind of a safety net. If somebody were to spend their assets down, then they do have a safety net to be able to have a program that would still take care of them, whether it be in a nursing home or help with their medical expenses. So Medicaid is good to have. If you've got assets, however, and money that we're trying to protect, having some type of long-term care plan, some private pay type plan to protect those assets so you don't spend down and go to Medicaid is really the planning piece of it that we advocate.
Yeah, and I think that makes perfect sense. Now, obviously, this is important, and so basically what you're saying there, Anthony, is the federal government matches the dollars the state government provides then.
That's correct, Tony. Those dollars, of course, are only guaranteed for eligible recipients, but there are a lot of eligible recipients, which brings us to our next Medicaid fact. The program covers 1 in 5 Americans and plays a critical role for certain populations. Medicaid provides care for some of the Americans' poorest and most vulnerable population, such as provided health insurance to people that otherwise may not be able to afford it. So again, it really is, a good program for people that need it, and it's good that it's there.
Yeah. Well, and I agree. Now, our time is just about up for this first segment of the show. Is there anything else you want to share with our listeners before we take a break here?
Yeah, well, I just want to thank you for tuning in, joining into the show. We really appreciate you spending your time with us, and we are going to offer this show as a podcast. So if you're listening to it on a podcast, we want to thank you for joining us. We really think that healthcare planning and long-term care planning is a foundational piece to any retirement plan. As you know, we do have 5 key areas that we think are important, and healthcare planning is one of those critical components. So I would encourage you, if you'd like to see what our formal retirement plans look like, and you'd like to get a copy of that so you can compare, take advantage of this offer.
You've been listening to our shows and advice on getting your finances in order and creating a retirement income plan that will last. Now is the time to take advantage of our special offer. This is Anthony Kangemi with Crescent City Retirement Group, and we're now offering our 3-step retirement planning process at no cost and a $100 gift card to the restaurant of your choice upon completion of the planning process. Call Crescent City Retirement Group within the next 20 minutes at 504-828-2171. That number again is 504-828-2171.
And welcome back to Retirement Keys with our host, Anthony Kangemi. I'm your co-host, Tony Shore. And today we're talking about long-term care, Medicare, and Medicaid. And we've been going through some things to know about Medicaid, so you have the facts. And just before the break, you were talking about how the program covers about 1 in 5 Americans usually, and plays a critical role for certain populations. And I think that's really part of it. And a lot of it is a nursing home residents, right?
Absolutely, Tony, it is. According to the Kaiser Family Foundation, Medicaid is especially critical for certain populations in the average state. It covers almost half of all births in the fiscal year of 2016. So half of all births in 2016 were covered by Medicaid, and Medicaid covers over 76 million low-income Americans. So, yeah, Tony, it is heavily relied upon for so many Americans.
Yeah, and especially for long-term care and nursing homes, right?
Absolutely, because Medicaid is so closely tied with long-term care, there's a decent chance that you or someone you know will end up requiring Medicaid's assistance at some point. Fortunately, our new point illustrations that Medicaid covers a broad range of services. Many states go beyond the services required by federal Medicaid law, electing to also provide care options including prescription drugs and physical therapy, eyeglasses, dental, and other things. So Medicaid, again, is very robust, and if you qualify based on your income, based on your assets, it really can be a lifesaver.
Well, and I think it's really good that the states do this, right?
Oh, absolutely, Tony. It is. In addition, Medicaid covers long-term care at nursing homes and many home and community-based long-term care services. The Kaiser Family Foundation reports that more than half of all Medicaid spending for large long-term care is now for services provided in the home or community, enabling the aging population and people with disabilities alike to live more independently.
Yeah, and that's what people want and are looking for, and they need help with. It surprises me, though. I had no idea how much long-term care factored into Medicaid.
Well, that's true, Tony. Most people don't. And another Medicaid fact that surprises some people is that Medicaid has a positive impact on access and outcomes. The Kaiser Family Foundation cites a large body of research that shows Medicaid beneficiaries have far better access to care than the uninsured, and that those beneficiaries are less likely to postpone or go without needed care due to costs. In other words, Medicaid helps people get the care that they need, and it's true. So it's a wonderful program. We need to have it. It's helped so many people. But I will say, as we talked about earlier, if you have assets to protect, I mean, just realize that if you do find yourself in a situation like a long-term care situation, if you do have assets, you may not qualify for Medicaid, and then they're going to want you to do the spend down, pay down the monies you have up to the criteria, depending on the state you're in order before you would qualify. So it's good that it's there once people spent their assets down. We like to try to help our clients protect those assets so they don't spend the money down, their money.
Yeah.
And that's what long-term care planning is all about.
Yeah, and I think that's really, really important, and I'm glad that you do that. I mean, it's good to hear. Obviously, people hugely benefit from Medicaid then.
They do, Tony. It doesn't go unnoticed among the people who are receiving the care. According to the foundation, Medicaid enrolls report satisfactory levels with their access to care. People are satisfied and feelings toward it that are similar to the levels reported by those of private insurance. Hopefully this look into Medicaid helps clarify some of the confusing things around it. But yeah, I mean, people that are on it are, for by and large, are satisfied with the services. So it's not that they're dissatisfied. So it's a great program, Tony.
Yeah, I think so. And this certainly has helped understanding all this.
Yeah, Tony, and nearly all Americans over age 65 qualify for Medicare, but not all care that they ultimately need will be covered by Medicaid. That's why Medicaid is there to cover expensive long-term care options for millions of seniors, whether it's a nursing home or their own home or community-based care like assisted living. So it makes sense that many seniors will end up receiving Medicaid benefits based on the types of care that they need. But another thing to consider is that still other seniors may end up qualifying for Medicaid based on their financial need, which leads us to the topic of our last segment, the importance of considering long-term care coverage and options.
Yeah, and that's the important part. So let's jump right into that. Let's not wait or dilly-dally, as they say. And we've been talking about Medicaid facts, but let's pivot in this final segment to long-term care insurance and long-term care solutions. And I know there's some myths out there about long-term care that you wanted to talk about. So let's start with that. What's the first myth you wanted to deal with?
Well, our first myth relates to something we mentioned earlier, Medicare. One of the more common myths about long-term care is that the idea that Medicare will cover long-term care costs.
Right.
However, according to the Morningstar.com article entitled 75 Must-Know Statistics About Long-Term Care in the 2018 edition, Medicare will only cover the first 100 days of your stay in a nursing home. So unless you plan on staying in a nursing home for just over 3 months, you're going to need some type of additional coverage. So Medicare does cover some part of it, up to 100 days in skilled nursing, which is fine. But as you know, Tony, some people might go years and years with some type of, whether it be Alzheimer's or dementia or Parkinson's or other debilitating conditions that require them to stay so much longer. And so, even though we do get some small help with Medicare, it really falls back. The bulk of it falls on the shoulders of the recipient.
Yeah, I mean, that's not a very long coverage period.
No, it's not. Only that period is fairly short, but it does not include any personal care either. So assistance with things like bathing and dressing and eating, we call those activities of daily living, and more will come at an additional cost. And then, of course, in-home care coverage is also very limited. So, yeah, I mean, whereas Medicare may have some little sporadic benefits there, it's certainly not, as you know, Tony, my dad spent the last 6 years of his life at a wonderful assisted living facility, private pay, St. Francis Villa out there in River Ridge on Jefferson Highway. And let me tell you, it was a beautiful place. He got the best care, assisted living now, not a nursing home,
right?
One of these like retirement communities. But I mean, he was a private pay. He didn't have long-term care insurance, unfortunately. And I mean, it cost him a pretty penny to stay there.
Oh, yeah.
I mean, it was well worth it because the place was incredible. But had he have had some long-term care coverage, and you may even be asking, well, why the heck didn't your own dad have a long-term care plan?
Sure.
And, the answer, frankly, is he was very stubborn and very hard-headed. Yeah. And I can remember a conversation that we had, and after he was, had his spinal stenosis back operation, and he was not walking very well, and he was needing assistance. And I remember him saying, and it was a little comical, I guess, but not at the time. It wasn't comical. But I remember him saying, well, Anthony, you remember you were talking to me about that long-term care plan. You think I could get something like that? And I said, well, Dad, it's too late.
Yeah.
I mean, that'd be like, your house is on fire and you try to buy fire insurance. I mean, it's too late. I mean, we should have done that years ago when we talked about it.
Yeah.
But anyway, he paid for it himself, basically.
Yeah, but it's expensive. I mean, not everybody has the means, and you want to make sure you plan for it, because we're talking even for a nice assisted living, and you can get different levels where they provide care and come, and if you need in-house health services, it can range from $4,000 a month all the way up to $10,000 or $12,000 a month. So it's not cheap, and you have to plan for that. But luckily, Anthony, there's a lot of different options to plan ahead for that, and some of them are very viable and very doable. What's another myth, though, that's common about long-term care?
Well, another idea is that an individual is too young or to worry about long-term care. This is a myth because premiums are based on many things: family history, policy details, gender, and health. And you may be able to lock in a much better premium at a younger age. You never know what health challenges the future may hold. Another statistic from the Morningstar article is that 45% of the individuals who require significant long-term care are under the age of 65. So there are many people who are not retirement age who can use the safety net of long-term care planning.
Well, you know what? We're almost out of time for today's show. It just flew by, Anthony. Is there anything else you want to add before we go?
Well, I just want to thank you all for tuning in and listening. We know that these times are very, troublesome for a lot of people. We've all had to adjust, right, in so many different ways. But I would just encourage you to look for the silver lining in it all, whether it be a closer closer knit with family, or learning new skills, or learning how to do things a different way, maybe even a more efficient way. So I think there's a lot of different takeaways. Obviously, stay safe, and we want to do all the things that we're supposed to do based on the guidelines of the state and the government. So we want to do all those things that we can do, but then also not to forget that we have to balance doing all those things and staying safe with everyday life. We do need a balance. I mean, we can't just hide under a rock or hide under our bed or under our covers. I mean, we still have families, and we have people dependent on us and people looking at us for encouragement. So I would just encourage our listeners to strike that balance, and we'll all get through this. Of course, we are getting through it, and we'll get through it. And for those families that have been directly affected by the coronavirus, and as far as actually contracting it, we just, our heart goes out to all of our listeners and all of our community. So with that, Tony, I just want to thank you again for joining us. And I would encourage our listeners, if you don't have a formal retirement plan, please take advantage of this special offer.
You've been listening to our shows and advice on getting your finances in order and creating a retirement income plan that will last. Now is the time to take advantage of our special offer. This is Anthony Kangemi of Crescent City Retirement Group, and we're now offering a complimentary gourmet dinner and retirement planning workshop, The 5 Keys to a Stress-Free Retirement. This is one workshop you won't want to miss. Call in the next 20 minutes for this no-cost offer. Seating is limited. Call Crescent City Retirement Group within the next 20 minutes at 504-828-2171. That number again is 504-828-2171.
Thank you for listening to Retirement Keys. Don't pay too much for taxes or retire without a sound income plan. For more information, please contact Anthony Kangemi at Crescent City Retirement Group. Call 504-828-2171 or visit the website at crescentcityretirement.com. All matters discussed during this show are for informational purposes only. Each individual situation may vary, and the opinions expressed here may not apply to everyone. Materials presented are believed to be from reliable sources, and no representations can be made as to its accuracy. All ideas and information should be discussed in detail with one of our qualified representatives prior to implementation. Anthony Kangemi and Crescent City Retirement Group are not affiliated with or endorsed by the Social Security Administration or any other government agency.